Hey there. Let's be honest for a second. Have you ever looked down and thought, wait, has it always been this size? Is something shrinking? You are not imagining things. Penis shrinkage, also known medically as penile atrophy, is a real phenomenon. And yes, it happens to a lot of men, especially if you are in your 40s, 50s, and upwards. But before you panic, know this. In most cases, it's manageable, and in some cases, it's even reversible. In this video, we're going to break it all down. Why it happens, what causes it, and what you can actually do about it. Stick around. This is something every man over the age of 40 years and above should understand. Let's get into it. Disclaimer. But before we begin, the information in this video is for educational purposes only and is not a substitute for professional medical advice. It is not a cure and should not be replaced with medical treatment or advice. Always consult a healthcare professional before making any significant changes to your diet or lifestyle. The number one cause is aging. First up is aging. As we get older, our bodies go through changes, and that includes a penis as well. Testosterone levels naturally decline over time. Blood vessels lose elasticity. And as blood flow decreases, the tissue inside the penis can start to shrink. It's not just about length. It can also feel thinner, softer, and even less responsive. Also, fat can accumulate in the pubic area, which makes the penis appear smaller, even if the length hasn't actually changed. Bottom line, aging affects every part of the body, and that includes your sexual health. But aging alone doesn't tell the whole story. Number two cause are lifestyle factors. Let's talk about lifestyle. Some of the most common causes of penile shrinkage come down to habits. Here are three major culprits. Number one, smoking. Cigarettes damage blood vessels and reduce circulation. Poor circulation equals smaller, less firm erections. Over time, the tissue can shrink. Number two, obesity. Gaining weight, especially around the belly, can bury the base of the penis under fat, making it appear shorter. And that fat can also mess with testosterone levels. Number three, alcohol. Excessive drinking can interfere with testosterone and contribute to long-term erectile issues. That affects not just function but also size and sensation. The good news is these are things you can change. Number three cause is medical conditions. Now let's dig into the medical aspects of things. There are several health conditions that can directly or indirectly cause shrinkage. One is Peyronie's disease. It causes scar tissue to build up in the penis, which can lead to bending, pain, and loss of length. Another big one, diabetes. High blood sugar damages blood vessels and nerves, reducing both blood flow and sensation. There's also high blood pressure, high cholesterol, and heart disease, all of which restrict blood flow. And let's not forget low testosterone, or hypogonadism. Without enough testosterone, the penile tissue can atrophy over time. If you've noticed a gradual change, or something just feels off, it's worth getting checked. Number four cause is medication or surgery side effects. Believe it or not, some medications and medical procedures can also lead to shrinkage. Let's start with surgery. Prostate surgery, particularly prostate removal for cancer, can sometimes damage nerves or restrict blood flow, leading to a shorter penis post-surgery. Some medications can have similar effects. Certain antidepressants, like SSRIs, selective serotonin reuptake inhibitors, blood pressure drugs, hormonal therapies, and even some hair loss meds like finasteride. These can all interfere with libido, blood flow, and erection quality. If you think a medication may be playing a role, do not stop taking it, but do talk to your doctor for advice. There may be alternatives. Number five cause is what is called temporary vs permanent shrinkage. Quick but important point. Not all shrinkage is permanent. Sometimes your penis looks smaller because of temporary factors like cold weather, stress, anxiety, or fatigue. This is completely normal. It's just your body's way of conserving heat or reacting to stress. But if the size change is consistent, happening over weeks or months, that could be something more structural. At this stage, consult your doctor. Permanent shrinkage is usually caused by tissue damage, reduced testosterone, or blood flow problems. But here's the key, early action can make a big difference. Number six and final cause is what you can do. So, what can you actually do about it? Here are 6 science-backed steps. 1. Improve your heart health. Cardiovascular health and penis health are deeply connected. Exercise regularly. Eat clean. Stay hydrated. 2. Lose belly fat. Even a 10 to 15 pound weight loss can reveal more of your natural length. 3. Quit smoking. Blood flow improves quickly once you stop, and the results can show down there. 4. Limit alcohol. Cutting back can help restore hormone balance and erection quality. 5. Consider testosterone therapy. If your levels are clinically low, supervised TRT, testosterone replacement therapy, might help, but only under medical guidance. 6. Strengthen your pelvic floor. Kegels aren't just for women. Men who do them often report better erections and better control. This isn't about size for vanity's sake. It's about function, confidence, and health. Having said all these, let's recap. Penis shrinkage is real but often treatable. It can be caused by aging, lifestyle, health conditions, medications, and more. And most importantly, it's often a sign of what's happening in the rest of your body. Your penis is like a health dashboard. When things aren't working right, it could be pointing to a bigger issue. So don't ignore the signs. Take care of your body, and in turn it will take care of you. Again, remember the information in this video is for educational purposes only and is not a substitute for professional medical advice. It is not a cure and should not be replaced with medical treatment or advice. Always consult a healthcare professional before making any significant changes to your diet or lifestyle. Alright, if you found this video helpful, hit that like button, subscribe, and share it with someone who might need to hear this. Thanks for watching. Stay healthy and stay curious.